Good afternoon, everyone. Welcome. This is the meeting of the March 26th meeting of the Fairfield Human Services Commission to order. We do have a quorum, but I'd like the commission members to go around and introduce themselves if I may, beginning with Dan. Dan Van Horn.
Oh, I'm going to say Sandy Berman.
Sandy, welcome. I'm Bernie Lynch.
Nina Chanana.
And good afternoon. And we have our first meeting of our new commission member, Ryan Price. Ryan, welcome. And I'd like to briefly introduce yourself.
Sure. Yeah, my name is Ryan Price. I'm coming up on 20 years in Fairfield. And lived most of it as an able-bodied adult. And then I got injured 4 years ago and now I'm in a wheelchair. So kind of gives me a unique perspective on things from a disabilities perspective. So happy to provide my point of view and help out.
Well, welcome. We look forward to working with you and all your insights that you can provide the commission. So thank you for participating.
Sure.
As I say, we look forward to working with you. With that, may I ask people to stand and say the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Okay, our first order of business, I'd like to welcome Marie Allen, Director of President and CEO of the Southwestern Connecticut Agency on Aging, more appropriate in SWACA. But Marie, welcome. And joining her, Bill Lenahan. Bill, welcome on behalf of Fairfield Senior Advocates. So, table's yours.
Good afternoon, everyone. And thank you, and thank Julie for inviting us here tonight, and all of you for allowing us the opportunity. That might make it a lot quicker.
Vote not required.
Ryan, I beat you by 1 year. 1 year as a resident.
Okay, good.
In Fairfield. In fact, I think I was a resident. I definitely was a resident before I became a senior. So
There you go.
I am on the board, as Bernie had said, Southwest Connecticut Agency, and the acronym, as you may know, is SWATCA. And I'm also, like Herb Cooler, a member of the Fairfield Senior Advocates. And I'm delighted to have today with us Marie Allen, who, as Bernie had mentioned, is the president and CEO of SWATCA. And she'll provide not only a brief on our agency's mission, but also describe what we're here today to talk to you about is some of our legislative priorities.
Thank you. So the Southwestern Connecticut Agency on Aging is a federally designated organization. The federal government has something called Older Americans Act dollars, and it's given to every state. Each state takes those dollars and divides it into regions. We have 5 here in Connecticut. And we take those dollars and we pay for things like home delivered meals. When you see the CW Resources trucks driving around the community, those are all funded with oversight from SWACA. We also provide grant funding for mental health, for dental services, for adult day centers, for some senior centers. The focus is on low-income individuals, but we also are required to provide unbiased information on Medicare. So we're serving all older adults or a person with disabilities who qualifies for Medicare. So our job is to help translate what is often very confusing in legalese information that comes from the federal government to our communities. We work very closely with the Connecticut Department on Social Services. And right now we have almost 100 residents in Fairfield who are part of the Connecticut Home Care Program, which is a Medicaid-based program that provides funding for an individual to use an alternative to nursing home. This is a really important key area, an alternative to nursing home. Individuals who are on this program would qualify for nursing home placement, but because of the services they're able to receive through Medicaid in their home, they're able to stay in their home. And that is an absolutely wonderful thing, because if you ask many older adults where they would prefer to receive their services and live out their days, it would be in their home as opposed to in a nursing facility. And I have to say, I see Mary Ellen Gavin here. Thank you very much. I want to recognize her as a member of our advisory council. So SWACA has 14 cities and towns under our purview, from Greenwich all the way down to Stratford, out to Monroe. And what we try to do is provide that grant funding, and also to build capacity in the cities and towns. Everyone, not everyone, has as wonderful a director as your human services, social services director. There are other towns that struggle with that position, but even in a town like Fairfield, where we have Julie, we try to collaborate. We don't duplicate the services that are coming out of human services. We are here to support. We do have access into the state systems, which are ugly, and many of you would not want to go into them. However, they give us information when a client goes to use their Medicaid card to get their prescriptions, and they're just told you can't, it's no longer active. We're able to get into the system, figure out what went wrong, hopefully correct it, and get that medication for the individual. So it's very vital, critical services, and the better connected we are to your town, the better we're able to help. We've worked with Julie in Human Services Department on clients that need more than perhaps what a town can offer, and we're able to supplement, work with those social workers and get what is needed. So we're coming here to you today, as Bill said, to talk about what's important in Fairfield so that we can create a regional legislative agenda that supports the Southwestern Connecticut needs of older adults and residents with disabilities who need support from state legislature and programs and services coming from both the federal and the state government. And SWACA have three main goals. We want to strengthen the home care system because, again, so many older adults need that support in their home and would rather forego the nursing home placement. Second, we want to have a system of service navigators so that we are connected to the cities and towns that we serve, and we're able to provide that enhanced level of support. And then finally, housing has become a huge issue in all of our cities and towns. Accessible and affordable housing is a real challenge for individuals who have outlived their assets or are now house rich but cash poor and need to find alternative housing. So that makes up the broad agenda for SWACA. But now I'd like to turn it over to Bill again a little bit to talk a little bit more about what's next, what is happening here. And I did print something out for you so that you have it, and also provide our brochure so that if anyone needs to contact us or has someone who they think could benefit from our services, please feel free to contact us.
Thank you, Marie. Ladies and gentlemen, we're here today to identify trends and priorities among the 14 towns, Fairfield being one of them, within the SWATCA region. And also, as Marie had mentioned, is to build a legislative agenda which supports our seniors and our disabled residents. And I'm sure it's no surprise to any of you that there's a commonality among all 14 towns in terms of the issues and the projects, despite, as I had mentioned to Bernie earlier today, despite the vast differences in demographics. Okay, Greenwich is obviously different than Bridgeport, and Norwalk is different than Wilton, but they all have a commonality of certain issues that are affecting their seniors and their disabled residents. And it would be a great, stronger voice than just one town or two towns addressing the legislation up in Hartford. But if we had 14 towns addressing, and along with their representatives and senators, it makes a much stronger voice for our seniors and for our disabled residents. Upon our conclusion, as we pull all this data together, we want to share that with you because we want you to see the issues that are affecting other towns and how perhaps some of these other towns are addressing those issues that might be different than the way Fairfield is addressing them. So we hope that we'll have that conclusion for you at the end. And what I'd like to do is now get into today's discussion with you is, what do you see as a commission here that are your top priorities for seniors and also for disabled residents, and how are you approaching it so that we can hopefully support you?
Well, I see a real need in, I don't want to use the word
affordable per se. I mean, everyone wants affordable housing, but I see a real need in that age group, 65 to 85, you know, where there's congregate living. We do that a lot in California on the West Coast, where we put maybe a lot of rooms, single rooms together in a home, same style homes together. But some kind of creative senior living for that age group to keep them here in town. Because, you know, a lot of the affordable apartments, I don't know a lot about affordable housing, but a lot of them are geared more towards younger families and not necessarily for the seniors here in our town. I remember asking Bill Gerber that question about a year and a half ago, and he said to me that basically the 8-30G developers aren't motivated to provide senior housing because they only get 1 point for a senior apartment versus 6 points for family apartments. And so our seniors are being squeezed out, not just for the tax issues, but because there's no place for them to go. So they've raised their kids here, they want to stay here, and they can't. So that's what I see as far as housing.
That is an interesting concept, and Herb knows that we had a member of our Fairfield Senior Advocates who was a strong voice for congregate. She had all examples up in Massachusetts and, as you said, California, how it worked. And part of the problem, obviously, and we all know, is land here in Fairfield. How do you secure it? How do you develop it with other, you know, against other developers, I guess, you know, with the 830G. Are there any other issues that you feel are strongly needed to advocate at the state level that we can help you with and support?
I mean, I think you already talked about it, but just aging in place is always something that I think comes up when I do senior work. Needing some supports in the house that they don't have, or figuring out how to modify the home. And then you definitely hear about downsizing, that not being a really feasible option because your downsizing house is going to cost as much as the house you're in. So that's obviously the housing issue.
Swampscott has many resources in terms of helping people age in place, but that is one of our priorities. And what always it comes down to is with the state is money. I mean, their motto is for seniors and disabled residents to age in place. Question always becomes, you know, the money issue.
Sure. I think the whole modifications that you brought up are a great idea, and I know the aging committee is trying to secure bond funding so that we can help people not at the Medicaid level. So it'd be those moderate income folks that we see that just don't have the funds to put in a ramp, to put in grab bars, to, you know, reduce the height of something, to make it more accessible. And we're very hopeful that those funds are going to come directly to the area agencies so that we can get them into the community instead of having them go through the state, which always complicates things. So I know Jane Garibay, Representative Garibay, Tony Huang, they're all on the aging committee in Hartford, and that's a priority for July 1. And we will certainly let you know if that happens, because I think that could help many seniors in Fairfield that have homes that need modification. Right.
Could you tell me some of the accomplishments that you've achieved this year? I know, Julie, I think we have a new caregiver discussion group at the senior center, which is
They have two.
caregivers are such a critical element for our seniors.
We have two caregiver groups. One is for active caregivers, and one is once they finish the 8 weeks, they can do an ongoing one. We have a few bereavement groups and discussion groups. The things that we're running into, and I'm sure that Mary Ellen can speak to this as well, and Marie, that there's people who could benefit from home care or companion care. There's 8,000 agencies. They don't know how to access that and how to pay for that and what they're eligible for. So we're constantly re-educating ourselves about these new agencies. And I know, Bill, this was a passion of yours, background checks and a list of, you know, if somebody had a report against them. Those are things that we worry about. And that comes up a lot in the caregiver group, is if to make people feel secure and get that respite care or take that break to go to a group, they have to be 100 times more confident knowing that their person is being cared for by somebody who's qualified and safe. Those are big things that come up probably every week for us.
I know in Fairfield, because I'm part of the Fairfield Senior Advocates, age friendly has been a thing, and there's 4 new age friendly, right?
Right? That we got to 5. Oh, communication was that last one. Should have told you that. Those are good. Transportation, housing, social engagement, communication, what am I looking at? Health, right. It's health and wellness. So we're working on that. That's an ongoing project that each year we need to do a report about those issues or those successes or resources that are available. And we're working on that, but the town is in great shape with, complete streets. The different improvements we've made to town, the sidewalks and things that we're trying to compile a list. Something we started with the Commission on Disabilities is how many resources are already available for people with disabilities, like the beach wheelchairs and like the new sidewalks that go down to the beach. People don't know about that. So that's something we need to get out there.
And I'm going to take something that you gave me a segue into transportation, which again, we're finding, we've been to 4 towns so far, and transportation just seems to be an overriding issue. In addition to housing, it just seems those are the top 2: housing, affordable housing, accessible housing, and transportation. And one of the keys with the transportation is, and I know we have a good transportation hub here and system, is what we're finding out is curb to curb. How do people with mobility issues, how do they get from their house to the curb? Because I know we have services from the senior center that pick people up, but again, it's the curb. And what do they do, and what resources are available to them to help them get from the house to the curb?
That's a great and frustrating question. Our transportation is curb to curb. GBT's transportation is curb to curb. So if somebody needs assistance getting from their home to the bus and in it, and off the bus into whatever activity and then back home, they need to have an aide with them or hire somebody to take them, because the drivers can't. We run into that a lot. We had a Anthony can certainly attest to this. We had a driver meeting because they are the nicest guys in America, our drivers, and they were bringing groceries in, they were carrying them around the senior housing sites, and they can't. They're not supposed to. And the passengers know. We have a 103-year-old, and they just can't even make eye contact with her because they know when she gets off the bus, she has to carry her groceries in. I know they're cheating, but they can't. They just can't. They can't not help. But that is a big issue, and also on demand is a big issue. We've got to come up with some kind of pilot. There's a couple of options, but the only real options are Uber, and then hiring like a home care agency for 3 hours for $75 or $85. So there's got to be some kind of answer. We don't have it yet, and we're lucky that we do have a transportation program. Some towns don't even have buses.
Exactly, yeah. And you have one that has a lift, correct?
All of them have lifts.
All of them have lifts. Oh, great. That's great. That's interesting. That's good.
And the one that just rotated off of service is now part of the adaptive rec program for when that center opens, to be available to help residents access it with perhaps at different hours than we have.
Are there any communities that have a driver's aide who can run in? Is that a system?
Not really, because then that's a town employee who's responsible, liable if somebody. There's volunteer services. One of the I don't know if it's, Marie, you could probably correct me. There's a proposed bill or a discussion of having a bill that reduces or drops the requirement for additional insurance for volunteer drivers like Fish.
No, that is, it's not yet. It would have to be approved, and it would start July 1. But the issue is that some insurance companies were dropping drivers who drove in volunteer programs because of the additional liability, and it would make it illegal for an insurance company to either charge you more for that insurance or drop you as an insured just because you're driving for one of those volunteer programs. So, I'm not sure that's 100% of the answer, but it's something that might promote some more homegrown volunteerism for driving.
I love Nina's idea about having a bus aid. I mean, they have that, the school systems for safety, that it could be a different position, not the bus driver, and they're not, but that they're a paid assistant that helps people on and off or gets them to the curb. I mean, it's obviously there needs to be money to pay this person, not a volunteer, to have it as a paid, you know,
We had explored
job.
a few years ago, but it is such a responsibility to be in charge of somebody who's unable to get on or off themselves. So that's
Their job, so they would be trained, and
Yeah.
it's not a volunteer, it would be like nursing homes have assistants that help patients maneuver around the nursing home and wheelchairs, and so it's a position that someone is got a different title, it's not driver, and it's
The problem I see with
Money,
that,
I
yeah,
mean,
it's money, but it's
somebody's
also
gotta
like,
pay for it.
when they're at home, who's doing the assessment about the proper mobility device? You know, grandma may refuse to use the walker and wants to use the cane, but she's not safe using the cane to go down the steps. And so.
Yeah, I hear
Yeah,
you,
it's
I
a
hear
big,
you.
it is a big issue. So who's makes that assessment of what mobility device they should be using safely to get out of the house? Like a whole assessment, if they have a couple steps.
It's always worth looking in and seeing if anybody else has found a way
Yeah.
to do it. Definitely worth looking, because we haven't looked at that probably for 3 years, but it's worth investigating to see what other communities are doing.
What the adult day centers do that provide transportation, because in many cases, individuals going to the adult day centers are mobility challenged or cognitively challenged and really do need that guidance getting into the home. So I'm just wondering, Julie, if that's not a place we could start, we could ask.
That's a great idea.
Okay, a couple of other questions that we had so that we can pull everything together is, Fairfield has different boards, Board of Finance in terms of tax relief, accessible, the Affordable Housing Commission. How does the Human Services get the information flowing between what your ideas and your concepts and your issues are with the other boards and commissions? Do you meet on a couple of times a year? Is it kind of informal where just members?
Sorry, it's me. Log it in. That means the sound works.
So, that's an interesting question. We have department head meetings monthly, and that any information that comes up through us, through this commission goes through me to the other department heads or to the first selectman. I don't know, the commission does not meet with other commissions.
But we have a standing
I go to
position.
the Board of Health.
Health.
That's, yeah. And then we had the first selectman come and
We
we invite
Yeah.
maybe.
And I don't know if it's recent practice, but the commission used to testify at public meetings on behalf of commission objectives
Yeah.
and senior center objectives, at things like the Board of Finance and various town meetings. I don't know if that's been a practice continued, but
Not lately. That would be nice to have that support for the budget process.
yes, we were
And other things.
we were pretty active in the budget process. I seem to remember, yeah. So there may be an opportunity there. So
Different
for
meetings.
more, but Board of Health, we have reasonably good representation and we get good feedback. Sorry, when I say we have excellent representation, I mean, we're well represented, but we have good participation on that, but there may be other opportunities for her to reach out. And I know the social services agenda is widely publicized throughout the town, in any event, their activities through the community newsletters, things like that.
Back in the day when we had the Commission on Disabilities, we tried to have representation for that commission on some of those more significant,
Whatever the streets,
right,
as an example.
on those kind of commissions, but it might be good to look at that again.
Question.
It's a question that all our cities and towns that we spoke with are grappling because they see the need for better communication within the town that really supports individuals, older individuals with disabilities. And so I think it's just great to bring it up and start brainstorming a little bit about how something like senior tax relief is essential to this committee as well as the finance. So having the voice of you folks at those important meetings could make a tremendous difference in the policies that come out.
Somewhat similar to what we're here today, trying to gather your input and later on this year, looking for your support to help us at Hartford, whether it be a written testimony or a Zoom or I hope not a in-person, because I don't know if you heard about Jennifer Leeper having her 19-hour marathon session on education, but she got home, I think, at 6 o'clock in the morning. So some of those meetings are very long. And that meeting, it would probably be worth sending a written testimony in instead of being on a Zoom and being number 600. But anyway, we do look for your support. And that's why I was saying, if you take the first step of meeting with some of your other boards and commissions, and then with us, with the 14 towns, if we can get together on some of the common issues that we need help for and assistance from the state, it's a much more powerful voice than just a couple of us writing testimony. So do you have, Marie, anything else? Sure.
In closing, I think I would say October, we're hoping to bring all the legislators from Southwestern Connecticut together. And it would be wonderful if we could have all the councils from all 14 cities and towns join us, because then they're hearing from the people that are really making impactful change in their community. So what our goal is to find those common trends, identify some areas where legislators, elected officials from the state could be helpful, have them understand that there is a common need across even cities that are as disparate as perhaps Bridgeport is to Greenwich or to Fairfield, that there is this common need for affordable, accessible housing, that there is a group of individuals who will never qualify for Medicaid, but do not have the liquid assets to truly support all their needs at home. So we need to look at that layer of individuals. And also to find ways to help people age in place. I think you said it, Nina, it is where people want to be, but it is so incredibly challenging. There's not one resource that anyone could create that you could just go to and say, okay, this is what I need, let me get this. If you call 211 and say, I need a home care agency, they're going to send you a list of 200 home care agencies. None have been vetted. None of them, they have all different prices. Everybody calls the stats something different. Some are PCA, some are AIDS, and call it the rural. All different names. So it's almost impossible for a family, a caregiver, or the individual to understand who would be coming into their home to help. And then the prices, how do I get help to pay for it? It's all dependent on the individual. So someone might look as though they have funds because they have this beautiful home in Fairfield, but they've run out of their liquid. They have no income and they might qualify for some of the programs. Someone else might think, well, all I have is 100,000, so don't I qualify? So it's really a matter of talking to the individuals, talking to the people. And that's where I think commissions have a role in helping to educate, raise awareness of individuals of what are the challenges of aging and what are the things you need to consider. So thank you so much. I know we've taken our 30 minutes, Bernie. I don't want to go over, but
I mean, I will just add, because I totally agree with you. I do a lot of needs assessments, and I recently did one in New Canaan for seniors. We looked at anyone over the age of 60. And then a year before that, I had done one in Stratford. So very different communities, but I have to say what bubbled up to the top, they were the same issues. And I can't imagine it's different here. So, I mean, we could think about doing some discussion groups with seniors that we could access through Bigelow. I did 60-year-olds in one group, 70-year-olds in one group, and 80-year-olds. And it was great. We got a lot of great information. So New Canaan has a really good needs assessment if you talk to them. I just did it last year.
Yeah, they're on our list. We're meeting with Penny Young to
Yeah.
go into the community. So great. Thank you.
Yeah, but it's a good idea. Talk to the consumers.
Bill, if I may, you had mentioned tax relief several times, and it was after we went through the legislative priorities. And I know a little about Fairfield's program, next to nothing about any of the other towns in the 14-town service area. But are we comfortable that the tax relief programs that are available are sufficient? Are there needs to make them more robust? Are the brackets right? Have they been changed recently? Is the communication about them sufficient so that people are aware of them? Things like that. Maybe more of a region-wide issue than we've come to think of, because obviously it's town-based. But I'm thinking all the towns are faced with the same dilemma with tax relief.
Most of them, yes, most of them are. I was, along with Herb, was an advocate of tax relief here in Fairfield. It does exist.
Yes.
We were looking to expand it, of course, to get more households. And we were also trying to have the commission, it's a completely different commission of board now. But we were trying to show them that one of the gold standards was Westport. Westport has a very viable and a very strong tax relief program.
I seem to remember some of the work that you guys, the senior advocates were doing on that. So might be. And is the tax relief program reimbursed by the state? Is it?
It's a separate state program.
Okay, so the two are separate.
They are separate.
And the state program is nominal.
Yeah,
It's a lower.
So it's town-based.
Renee, one of the things we're hoping to do, though, is to get the information on senior tax relief in all 14 cities and towns and create an Excel spreadsheet
That'd be
so that we
wonderful.
can share them with all the towns for no other reason than to, let's find what are those programs that are working, how are they being funded? One of the byproducts of these meetings will be, do we have any great new programming ideas that maybe one town is doing that could be replicated in another town? So.
And Bernie, the senior center does a great job of trying to communicate the tax relief program. Herb knows that one of the suggestions on our part was to put those programs in their tax bill, so that the senior homeowner would see
Yes.
it right there with their tax bill, and see if they qualify.
Yes. I think that did happen, didn't it?
There were one or two notices that did go out
Yes, I see.
announcing the program. It doesn't happen on a regular basis.
Because I think communication, particularly with an older senior community, is always difficult, particularly in Fairfield.
Especially if they're a caregiver or happens to maybe be a sibling or a child, one of their sons or daughters, they can read it and see what's available. Yeah. They could be paying the taxes for it.
All right, well, thank you. Is there any other questions for Marie or Bill?
Just add two things.
Please.
One
Sorry.
is that you'll be happy to see when we send out the new community services catalog, senior and disabled tax relief is in there, as are many of our programs. So that is going to 27,000 households, is that right? And the second thing was the town has access to a lobbyist. So as we identify those bills or proposals that are before the legislature, we can, as a group, request that the lobbyists work on those. As we have to be organized and, right, why we want to do that, but we can.
That's great news. I didn't know that. Okay. Perfect. Okay. Well, thank you all. We really appreciate your time, and we look forward to coming back with the conclusions, our summary, the Excel spreadsheet.
Yeah, that's great. Thank you.
Thanks very much. All right, the next item on the agenda is Emily, if you're ready for us, we're ready for you.
All right. Well, thank you everyone for having me back. I recognize some faces from last meeting and some new faces too. My name is Emily Larkin. About 4 months ago, I started a new position as the town of Fairfield's first ever youth services social worker. And it's been wonderful to kind of hit the ground running. And I've come to present to you some preliminary findings from the needs assessment I've been working on over the last 3 months. So a few disclaimers as we dive in, because I need to eventually get home and relieve my babysitter and we won't be here till 10 p.m. We'll keep this kind of broad strokes, top line findings. And if you don't mind, if you have questions, jotting them down, we'll leave some time for Q&A at the end. And what else? Yes, if you are really interested in diving in very deeply in the youth services ecosystem in Fairfield, there is a 26-page single space document. So we're still working on finalizing that, a few interviews to come. But if you're interested in doing a really deep dive, we can certainly produce that for you. So this is just a cursory overview today. So we'll just kind of share a refresher on what this youth services social worker role is looking like so far, needs assessment findings, and then some recommendations based on those findings. So that's what we'll dive into. So for anyone needing a refresher, I know we have some new faces since our last meeting. This youth services social worker role is a brand new role within the Human and Social Services Department. And really the goal is supporting Fairfield youth families, connecting them with the resources they need, bridging between schools, town, community organizations and resources, all with a goal of prevention and early intervention. That's been a theme that's come up over and over again in these needs assessment conversations, all with the goal of helping youth and families thrive. And I think we're all in the room today because we care about seniors and older adults, we care about children and youth, and we want to see every student and family in Fairfield accessing what they need and growing up healthy and reaching their full potential. So that's kind of our vision and goal here. And then what does that look like in this role so far? So we've got three kind of pillars or core functions to simplify. First is care coordination. And in the last few months, if you would believe it, we've already received referrals from elementary, middle, and high schools, public and private in Fairfield, with referrals, whether for case consultation or for more like intake one-on-one intensive work. So it's been exciting to see people utilizing this position already as a resource. Second, our goal, of course, while we would love to do case coordination for 60,000 people who might need support in Fairfield, we want to scale sharing educational information, resources, support at the population level. And so we're looking at education and programming for youth and for parents. What are the gaps and what kinds of partnerships could we forge and leverage to meet those needs? So we're thinking kind of bigger picture as well. And then finally, we want to be kind of a community resource hub, upskilling people who are working with youth every day, whether they're clinical or non-clinical. Something that we did in January that was really exciting was we hosted a CRIM training, which is an evidence-based trauma-informed model that we shared with 50 youth-facing providers in Fairfield, and the feedback was glowing. So we like the idea of being able to kind of be a hub for capacity building, training, and supporting people who are boots on the ground with youth every day in Fairfield. So that's a quick summary of this position and some of the core functions. Now, as we dive into the needs assessment, a few framing thoughts. Everyone in this room knows whatever town a student is growing up in, these are the things they need to thrive. And so as we approach the needs assessment, the question we were all asking and I was asking is, so how's Fairfield doing against these kind of healthy development goals and milestones? So process-wise, I ran the numbers this afternoon. I have spoken with 203 people from 61 groups right here in Fairfield to learn from them their insights and experiences. Was this overly robust? Nina might ask. Possibly. But it was every single conversation yielded really valuable insights. And what was really fun about the process is every single person I met with, I asked, who do you think I should meet with next? And so there were some interesting people that emerged who had a lot to say that maybe wouldn't have been on my radar initially. So we had a wonderful cross-section of people contribute to this process and more to come. I think over the next 2 weeks, we'll probably be wrapped up. And so you may be curious, what do these people want to talk about? People who are so familiar with the fabric of positive youth development in this community. And so I'll share just top line a few key themes that emerged. The first was around the diversity and wealth gap that exists in Fairfield. And we heard over and over again, this is a resource-rich community, but with uneven access to those resources. And it has been reiterated to me over and over again, from student to parent to clinician to principal, that we can't have an accurate, responsible conversation about youth and families in Fairfield without acknowledging this wealth gap. And just to illustrate that, 18% of Fairfield public school families are on free and reduced lunch. 1 in 5 meet criteria for ALICE. If you can imagine ALICE, that acronym stands for Asset Limited Income Constrained Employed. So these might be families who are just above the threshold for the SNAP requirements, for example, but are still financially vulnerable and at risk. And that shows up in a lot of different domains of their lives. So a town morphing into a city is also a phrase that's been used talking about this wealth gap. Second, social media and devices, shocking no one in this room, I'm sure. This was a huge topic of conversation, adults, students alike. And if I could construct kind of a heat map from all of these interviews and focus groups, this I would say had the most heat in every conversation. And there was a lot of excitement about the phone bans, a lot of opinions about the phone bans, a lot of concerns about the way phones are shaping the lives and development of our children. And as all of you know, I'm sure just yesterday, Meta and YouTube were found negligent in that landmark case in Los Angeles. So there's a lot happening in this space. I think parents really have an appetite for learning and how do we set the right boundaries? How do we protect our kids and not make them an outcast because they don't have a phone and they're 17? Like, it's a lot to navigate. But a quote that stands out to me from my interviews with students is I spoke to a 17-year-old girl who has been through really significant mental health challenges, not kind of your garden variety. And she shared, I can trace the beginning of my struggle with anxiety, depression back to being in 8th grade and just scrolling on my phone nonstop, looking at kids whose lives look so much better than me. They were so much more beautiful than me. And that she really identifies that as kind of the genesis of a lot of challenges for her. So social media and devices, so much more to be said. Third is around the importance of third places that are not home, they're not school, they're third places. And it's been reiterated to me over and over again how crucial it is for students to have places that foster a sense of connection, belonging, and purpose. And we have a lot of these places in Fairfield between school sports, library programs, parks and rec, faith communities, arts programs, after school clubs, the list goes on. And it's so powerful for students to have these spaces where they feel like they belong. There's a sense of purpose, joy, connection. And there are students who access these places a lot, and it's really helping them to flourish. And there are also students who aren't able to access these third places because of transportation, financial, and other barriers. So that's something we really want to keep an eye on. Theme 4, again, I know none of this is shocking to anyone here. Parent overwhelm and burnout was a theme that came up over and over again, and certainly aligns with the Surgeon General's warning in 2024 around caregiver burnout, which is some great reading if you haven't dug into that. In the words of one faith leader who I met with, he said, just managing the logistics of our kids' lives is so tough on a marriage. And I loved the honesty of that. And a school social worker added recently, it's not that parents aren't trying, it's just so exhausting to figure out how to accommodate, but not over accommodate my kid's anxiety. And I'm caring for aging parents. And did I sign that permission slip? And should my kid be seeing a specialist for their anxiety? And why did my 3-year-old, when I dropped her off at preschool this morning, tell me I don't love you? That was me. That was actually from this morning. And I'm still working through it. But it is hard to be a parent in 2026. And 5th, youth mental health concerns. And certainly this is not unique to Fairfield, but we are seeing nationwide an increase in diagnoses of depression and anxiety for students as young as elementary school. And so that's something that's come up over and over again. And the schools are encountering a lot of challenges with identifying the right outpatient therapy referrals, barriers with insurance, transportation costs. There's a lot there to dig into. So that's just a quick overview of some of the hottest topics. Now, what are we doing well in Fairfield? We all know this is an amazing town. 95% of residents report Fairfield is a great place to raise their kids. And this is not all doom and gloom. As a Fairfield resident and parent, I was overwhelmingly encouraged by the findings, especially as it relates to what a wonderful, supportive community this is. So we know we are providing safe and resource-rich environments for kids. That came up over and over again from children through adults, a deep sense of community connectedness, extraordinary public and private schools, third places like we just mentioned. A lot of people referenced how there's so much that exists here. It's really easy for students to find their niche and their people and feel connected and part of something. And so that's a huge area of success. We could spend 30 minutes delving into that. The second is around relationships with caring adults. This is like the #1 trauma buffer indicator for positive and healthy youth development. And there's so many caring adults at home, at school, in third places that exist to support kids at Fairfield. And finally, dynamic third places between the YMCA, Wakeman, youth groups, the rec department. We have endless third places that exist where students can connect and belong. So zooming into Fairfield youth strengths in particular, of these hundreds of people, and I think we had about 75 participate in different focus groups, what stood out to me was we have, by and large, driven, engaged learners in Fairfield, conscientious kids that want to work hard and do well. A deep sense of social connectedness was reported across interviews, and a real sense of being purpose-driven, which is really exciting. Kids who care about global and social issues, who want to advocate, use their voices to make a difference. Like, this is a really special generation in a lot of ways. And something that especially stood out to me as a social worker who's worked with students in different communities is the level of emotional awareness reported by adults who work with these students. 10 years ago, it wasn't in kids' vocabulary to talk about anxiety, to talk about mental health, to talk about triggers, whether accurately or sometimes inaccurately, and to really exhibit the level of help-seeking behavior that we see among students at Fairfield, which is a tremendous strength. And I'm talking to Julie and Nina earlier. A few weeks ago, I went to Greenfield Hill Congregational Church, and they established this Night of Hope where they had about 75, 80 students, and about 30 of them got up, took their microphone from 7th to 12th grade and shared about their experience of struggling with anxiety, depression, bipolar, lots of different mental health diagnoses, and the way that they have experienced reaching out for help, support, hope, and transformation. And it was one of the most moving things I've ever seen, the most organic, like it wasn't choreographed in any way. Kids just stood up and grabbed the mic. And it was this really profound experience of vulnerability, community, kind of like mutual support and love. And so the fact that that's happening in Fairfield, I think should be heartening to us all. All right, moving on to Fairfield parent strengths. We see so many strengths in the students in Fairfield, and I think there's a pretty clear direct line to what the parents here are bringing to the table. So over and over again, we hear about intentional, proactive parenting, parents who are researching and using the resources available. And if they're not sure where the resources is, I'm getting phone calls and Julie's getting phone calls, which is wonderful. Building connected and supportive parent networks, wanting to kind of share in the highs and lows of parenting in community in different ways. And one of my favorite stories, I met with a community leader recently who shared just in the last 24 hours before he met with me, 2 fathers had approached him, separate conversations about wanting to help their 2-year-old sons build an emotional vocabulary. Was that happening 20 years ago? I mean, this is pretty extraordinary. The care and love and intentionality parents are showing, wanting their kids to develop in a really holistic way. And kudos to those dads. And I'm sure those 2-year-old sons are going to be doing great with their emotional vocabulary in the future. So shifting gears a little bit, there were some needs and challenges identified. And we want to just kind of quickly, I know we're probably running short on time, just touch on some of those, again, really broad strokes. What were we hearing about the elementary school age? Consistently, we met with every single elementary school social worker, counselor, school psychologist, and the director of mental health for the district. So we had a really good sample size contributing here, and they reported developmental delays, struggles with self-regulation, attention, social skills, fine motor skills came up over and over again, and mental health concerns among this age group. So there's a lot to look at here. Again, it's all really consistent with national data. This isn't unique to Fairfield in any way, but there's a lot of opportunities to support not just students, but their parents in this age bracket. Now, by the time students get to middle school, this is where there's a huge uptake in phone use. And boy, was there a lot of content around the digital and social dynamics, the group chats, the YouTube, the TikTok of it all, as well as a real sense of performance pressure. Students as young as 11, 12, 13 talk about stress and anxiety related to college choices and the classes that they're taking and how that's going to map onto their college transcript. Certainly something I wasn't thinking about in my middle school years. And then we heard a lot from the different middle school groups around overscheduling, students feeling like they just don't have a minute to breathe between the cello and the piano and the sports and their debate club. Kind of that resume building is already beginning, as well as students who have nothing to do after school. When we met with the team at Tomlinson, their administrators, school counselors, and psychologists, they shared there are kids that have nothing to do after school. They're going home for 4 hours and just scrolling TikTok. And if they had a magic wand, they would create after school structure and mentorship and movement and homework help. And they would create support that these students really need, but aren't able to access for different reasons. And then all of these different factors bleed into the struggle with anxiety. One of the leaders I spoke with shared there's an ambient anxiety in every room I walk into with middle schoolers in Fairfield. And that's kind of across socioeconomic status. And then finally, we get to high school, and the academic and performance pressure are often at a fever pitch. Different leaders and clinicians have noted when the social emotional challenges weren't attended to in the elementary school and middle school years, oftentimes we see a lot of challenges in those high school years. as well as when students get their licenses, there's more freedom, a lot of the substance use uptick and the concerns about the health risks related to that. So there's a lot happening in the high school years. And then, of course, the parents are trying to manage all of this. And so whether you have a toddler or a teenager, Fairfield parents report struggling with stress, overwhelm, burnout, and just not being able to keep up with a rapidly changing landscape. There are new, I don't know if you're all familiar with Kratom. There are new drugs on the market that didn't exist 6 months ago. Managing screen time in the ever evolving landscape of what apps and how do we manage this? My kid was kicked out of the group chat. What do I do? There's so many ever-changing things that parents are working on responding to, and such a need for support, for education, for skill building, and for connection and community in the midst of all of that. And so one of the things, as Nina knows, who's done many a needs assessment, we always want to keep an eye on is who are the most vulnerable populations, who could be falling through the cracks that we need to ensure there's a solid safety net of support. And so the first are the Alice families we spoke about earlier, that kind of bottom 20% who are financially at risk. And these are families walking into human and social services every day. And working on intakes of these families has really been an education for me. How many families in Fairfield are living so close to the edge with escalating financial crisis, and how difficult it is to get your kids into a Y swim session that would be such a positive thing for them when you can't pay your rent. So I could go on and on about that from earlier conversations today. Students with learning differences, really across the spectrum, from the autism spectrum to students who have just been struggling in school for 5 years, haven't gotten the right diagnosis and support. We hear a lot about the need for more support, whether kind of socially and also for parents of that population. We know from our 2025 Fairfield Cares data that the LGBTQIA community is uniquely reporting, I think, double the mental health distress of their peers. They're much more likely to be using substances and struggling with making risky choices when using substances. They're less likely to feel connected to their families and feel supported. So they're a group we always want to be mindful of. We also heard at Fairfield Ward High School, if their top of their wish list is more support for recently arrived non-English speakers who are presenting with complex PTSD, it's really difficult for them to access resources. And then finally, school avoidance. That we heard across every middle and high school conversation, especially post-COVID, what an enormous challenge that is, and how they're working so hard to address it, and are just really struggling with that as an overall theme. So where do we go from here? And our final 2 minutes together. So something that I think is really important to keep in mind as we think about recommendations is these are complex community problems, right? I would love to stand up here and say singularly, I solved it. I can identify these problems and here are solutions. But these kinds of problems really require cross-sector collaborative community solutions, right? And so looking toward 2026, where's our low-hanging fruit? Certainly case coordination. It's wonderful that we have open lines of communication with each and every school in Fairfield, and we're collaborating with them on really difficult student and family cases. There's also opportunity to offer support groups to some of these more vulnerable populations, and the school, and I think other behavioral health providers would be excited to collaborate with us on that. Certainly there's opportunity for parent programming, for centralized communication. I think with the new community services website, with the monthly e-newsletter digest, there's a lot we can do to kind of enhance the coordination communication around parent programming. And then finally, around supporting those working with youth every day, we hear a lot about opportunities for capacity building, providing more trainings. I'm so excited to share that Sarah Payne, the head of school nursing in Fairfield, is bringing a trauma-informed training to every single Fairfield public school nurse coming up in a few months. And we got to kind of make those introductions and help get that moving. And then I think there's opportunities for behavioral health provider expos, kind of just building relationships between youth serving providers, the schools. That's come up over and over again in school interviews, is the desire to be more connected with people who are serving youth on an outpatient basis. So I think Fairfield Youth Services in this role can kind of be a hub and connector with a lot of these relationships. And then finally, looking toward 2027, 2028, where can we make an even greater impact? And I think there's specific vulnerable groups listed here that we can collaborate with other community partners to design programming interventions for. And then there's also the community at large, kind of looking at vulnerable groups, but then also looking population level, what would make a difference. And I think looking at after school structure and enrichment for kids who really need it, and looking at substance-free events for middle and high school. We have our peer communities, Norwalk and Westport, are launching some really exciting programming in that space. And I think we can learn from and replicate it really effectively So just some good protective factors there. And then in closing, thank you all for being so patient and attentive. Jennifer Wallace is kind of one of our big thought leaders in this space right now. And I think she encapsulates what our hope is for youth in Fairfield here. We want them to feel connected, to know they matter, and to give them opportunities to make a difference in their community and beyond. And so that's kind of our hope with all of this work. And really grateful for your attention. I know that was a long presentation, so thank you. Yeah. A lot to digest.
That was amazing. Very impressive.
Having left.
I think what struck me is so many of the problems are interrelated. And so you initially talked about parent burnout. Well, you know, when you have kids, you have 3 kids that are signed up for 3 different sports in one season and then another, and piano lessons. And so the overscheduling, and then you've got all the other issues that you mentioned. No wonder there's parent burnout. So it's so many of the things are interrelated. And then you get the anxiety from the kids, the pressure for school. And it's true that they start really in early middle school talking about college with kids. And I just think it is so, I don't know about Fairfield, I worked in Westport, but in Westport, you're scheduling the courses that look good on an application for college, and they're starting to talk to kids in middle school, and that's when kids are starting to think about it, and they just can't be kids, and they don't even enjoy being high school students because most of high school is preparing for applying for colleges. So it's very difficult. It's a real problem and a real quagmire, and it's all interrelated. And then of course it's stress. And then, I mean, I know a lot of kids applying for colleges who then go into therapy because at that point, because they're so stressed out about the college process. It's very interrelated. I guess I am glad I'm not a parent. It is very, very difficult. But you did a great job of really researching it.
I was just gonna say, I think one of the remarkable things is about how far the conversation has moved in such a short space of time, because it was not that long ago that any conversation about needs in the school-going community in Fairfield County and their families revolved solely around substance abuse and underage drinking, various types of substance abuse, particularly in middle schools at the time, where Fairfield was outranked all of the neighboring communities on a number of different levels. And to see it evolve into where we're talking about emotional intelligence of 2-year-olds and the wraparound services that support youth development are particularly important. So it's just remarkable to see the change. And I know the department is a major role in that, and the evolution of Fairfield Care, so they have contributed to that expansion of definition of what issues are facing youth today. But it's a remarkable needs assessment, and I can see a lot of work emerging out of it in terms of how we move forward to supporting the communities. Particularly interested in the issue of disparities, access to resources. Obviously it's not access to public resources, but the differentiation and access to private resources that support development is actually pretty significant. And I think it touches on same issues we're talking about seniors in many respects. It's not much different. It's in terms of the impacts that they have on issues like depression. Can I stay here? Is it affordable? And how newcomers, particularly in Fairfield, actually access services as well. Particularly the community may not be that proficient in English. Absolutely. Amazing. It's a fantastic summary of what needs are out there, what can be done to improve the lives of so many. So congratulations.
And I'm so glad you mentioned Fairfield Cares just now, because as a little bonus for anyone who's wanting to kind of lean into the conversation about tech in students' lives, Fairfield Cares and a bunch of local organizations are bringing this extraordinary speaker. I think it's $15,000 for an hour event. You can pull up a TED Talk if you're not able to come to the event, but this will be an extraordinary conversation. And Fairfield Cares, I think, is providing a lot of the funding for it.
I don't have my distance glasses with me. What's
Yeah,
his
me
name?
too.
I'm sorry, so Max Stossel, he's really good. I've seen him present. He does a nice job.
Sorry, didn't hear his name, Matt?
Max Stossel,
Oh, Max, okay.
Stossel. He's had some books.
Can forward this to the commission.
Yes, thank you.
Extraordinary communicator, like, and I think he used to work for a lot of these tech companies and is now kind of speaking out about certainly the case from yesterday, things like that.
We'll send that out to everybody.
Yeah, really good one.
All right, any other questions or discussion points for Emily Welsh?
I had a question on what, do we know what percentage of the school population are non-English speakers as a first language, or what amount of population that you're talking about?
I have it in my 26-page document. We can report back.
Yeah.
But just maybe 2 weeks ago, I had the school referred a Portuguese speaking mom to my office. We were like using Google Translate to go back and forth. It's not the most elegant conversation. But just even that one case was such a loud example of
Oh, sure.
it's really hard to access services when you, yeah.
Absolutely. I was just wondering how many, I mean, every family matters, but I'm just wondering how many.
Say, we will send that out.
I'm just curious.
I think the census data, which is now a little bit dated, but the American Community Census data showed a significant increase in Fairfield households with limited English proficiency over their 5 and 10-year reporting periods, but it's been growing pretty significantly. And we all can see it, obviously. So.
Something else that we're planning, Emily will present the actual full report. This was just a little snippet of it all. We don't have a date yet, but sometime in June for breakfast, and you guys will certainly be invited with a facilitator. That should be amazing. No idea when yet, sometime in June.
So it looks like in Fairfield, the district has, if they call it English learners or multilingual learners, it's 3.8%. And the state, just for comparison, is 11.3.
Did you say 28%?
3.8.
Oh, I'm sorry.
Yeah,
3.8, that sounds.
yeah. That just means that they're in a program, so
Right,
they
right.
might have enough English proficiency to
Right.
not be diagnosed. But
Uh-huh.
they might have started out without English, like they're just now at a place where they don't need support.
Out of how many students? 3.8%, how many students? Is it 8,000 or?
In the district,
Yeah.
And 5.
is, well, last year it was 9,100. Interesting. Pre-K to 12. We do have
You
a
said
couple.
the state was 11 something? Way under, I would assume that, yeah.
Yeah, but it's probably increased. I'm sure it was lower even before COVID.
So not only is Emily an amazing needs assessor, but she's a fabulous social worker in addition to the department, because we have referrals from the schools and she is our go-to now. It's wonderful.
Well, the needs assessment was such a lovely way to just kind of do an introduction tour around town. And I think because there's only one school, I'm working on Fairfield Woods Middle School, getting in there, but every other school to have like a warm connection and match a face and a name through the needs assessment, I think has made counselors and social workers more likely to pick up the phone and kind of share, we don't know what we're doing in this case, like, can you help? And it's nice to have all of those open lines of communication. Yeah, great job.
Thank you, Emily.
I know, I gotta go relieve the babysitter. Is this hosting the Zoom meeting? Should I be?
No,
That is, I can turn this off and I won't disconnect everybody. Okay, perfect.
Thanks again, Emily. All right, moving on, old business.
I had a lot of notes, but I'm gonna just give you guys a couple of the highlights. Cause a lot of it is just sort of ongoing updates that we get, but the Reef Shack, which I don't know if you know, it's just not far from here. It used to be the old 7-Eleven. They had a lot of issues with underage drinking. So they have shut down, the town they've gotten the liquor license taken away. They had fire citations, unsafe situations. They had a lot of challenges. And now but the problem is now it's kind of turned into a bring your own BYOB. So So they're still sort of struggling with that, but that was one of the issues that was taking a lot of attention. The other thing, I think the other thing that was really, really fascinating was SANS had access to the wastewater analysis. It's new. And he pulled it up on a screen and it's what, like a time, day and time. And it's just a list of all of the drugs that are in the wastewater from that day it was tested. And I'm not kidding you, it was hundreds. And it was fentanyl, carfentanil. It was a lot of definitely dangerous narcotic opioid substances that turned up. We spent a lot of time looking at that, and I think we're gonna circle back because we had a lot of questions, but that actually is something I would love to share with you guys if I'm able to, because it was really interesting that you just kind of wonder, is this, somebody who's just been released from the hospital with fentanyl patch? Is it somebody using it because they have substance use issues? Like, we were all like blown away by what they found in our wastewater. So that was interesting. And then, there's update on vaccinations. They did a lot for Heart Healthy Month, hands only CPR. All good, but yeah, so those were kind of the two big things.
All right, thank you. Just quickly on commission priorities, we had an initial conversation at the last meeting about perhaps looking at some type of committee structure or commission member being responsible for various activities of the commission and reporting to the commission. And two of the areas that we identified were continued work on disabilities, and also following the presentations today, also looking at how we might organize ourselves in an advocacy role where appropriate. And that's also being consistent with whatever town regulations might be imposed on us. But for example, I do remember when the commission members did present at town meetings on behalf of the commission agenda as well. So we're going to look at that, but if anyone has any interest in working on issues related to disability that could be brought forward or should be on the agenda for the commission, and also how we might organize ourselves on an advocacy front, we'll just, as this is an ongoing, continuing discussion, and look to have committees or commission members involved. And this, I'm not considering this to be a work assignment, but really an area of interest for all of us that might have a lead person on as well, or a lead commission member. So we'll look to have that organized, I hope by the fall. But anyway, let's just keep it alive as an agenda item moving forward. And Julie, changes to the ADA?
So next month, we're having Heather Gately, who is a dementia specialist, but also is doing some consulting work and advocacy on behalf of the changes that include dementia as a disability for communities. Risk management is working on a townwide policy and what that looks like for the town and how that changes what we're doing. When that's complete, I'll bring it to you so you can see what the town is thinking. So they're hearing, the town is hearing that this change is coming and looking at it, which I think is wonderful. There is next month.
Thank you. Moving on to the department update.
I'll just be super fast. There's the senior center's doing great. I have the flyer. We also have a new logo. We had been using just the sign, and it's much better to have something else. The community services brochure is coming out in the next couple of weeks that has everything that is happening at the senior center, both senior center programs and community services programs and social services and other town programs that are addressing the needs and provide resources to our residents and our senior center members. So keep an eye out for that. And the town has kickstarted the opioid task force, because you'll remember we are receiving settlement money from several of the pharmaceutical companies. And we had our first meeting last month and have another meeting, I think April 2nd. That'll include several different departments and expand. So keep up to you on that, and if you have ideas
I
of
have
how
a
that money.
lot.
I think you're.
So if you
perhaps
want me to
already-
come,
Mhm. Yep, that's great. That's great.
I have a
I'll
lot of
just
ideas.
write Nina in
Yeah.
charge. Yeah, okay.
Get in.
But I'm excited about that because that's been a long time.
Yeah, it's a big chunk of
dormant.
change.
Yeah, it is. And there's more coming with more settlements.
Just before we adjourn, two quick items. March is National Social Work Month, I
It
believe.
sure is.
And I've been reading, and there has been an awful lot of positive coverage of Fairfield Social Services Department in local press and community that I've seen around. And I think it stands well for both the department and the leadership of the department. It's just great reading about the activities in the local papers. So congratulations on the outreach and the success in getting it. Secondly, I'm gonna see if we can get the minutes posted, but I'm gonna ask if we have an opportunity to vote on the February meeting minutes. Had an opportunity to look at them, review them. And I'll entertain a motion to approve.
I make a motion.
All right, are there any questions or changes to the minutes anyone would like to make? May I have a second to approve the minutes? Second by Dan, thank you. And any opposition to approving the minutes? Consider them adopted, thank you. With that, I'll entertain a motion to adjourn.
Motion to adjourn.
Second, Dan, thank you.
Thank you.
Thank you.
Yeah.